So these are our movements of the cervical spine. So starting with flexion and extension, lateral flexion, and then rotation. So again, we have flexion and extension, lateral flexion, and rotation. So here we see the movements of the shoulder. We have flexion and extension, abduction and adduction coming across the body, external rotation and internal rotation, and horizontal ab and adduction. So again, we see the movements of the shoulder. So we have flexion and extension, abduction and adduction, external rotation and internal rotation, and horizontal abduction and horizontal abduction. At the scapulothoracic joint, we have elevation and depression. We have protraction and retraction, and upward rotation and downward rotation. In the spine, we have flexion and extension, lateral flexion, and rotation. Again, we have flexion and extension, lateral flexion, and rotation. At the elbow, we have flexion and extension, and then at our radio-ulnar joint, we have pronation and supination. In the wrist, we have flexion and extension. We have ulnar deviation and radial deviation. Then we have flexion and extension, ulnar deviation, and radial deviation. In the fingers, we have flexion and extension, ab and adduction and ab and adduction, and then opposition of the thumb and the pinky. Remember when we talk about ab and adduction of the fingers that the middle finger is neutral. When we spread the fingers out, the first and second fingers abduct, while the fourth and fifth adduct. When our fingers come back together, the first and second fingers adduct, and the fourth and fifth fingers abduct. In the hip, we have flexion and extension, abduction and adduction, internal rotation and external rotation, and then horizontal adduction and horizontal abduction. Again, we have flexion and extension, abduction and adduction, internal rotation and external rotation, and horizontal adduction and horizontal abduction. At the knee joint, we have flexion and extension. In the foot and ankle, we have dorsiflexion, plantar flexion, inversion, and eversion. Again, plantar flexion, dorsiflexion, inversion, and eversion.